Welcome back to Restorative Interventions. This will be an educational video series of how to incorporate restorative yoga into practice for post-stroke clients in occupational therapy. In this video, I will cover appropriate settings, practice preparation, and props to consider using with clients. The intended audience for this series are occupational therapists and similar medical practitioners who are looking for restorative yoga practices to include in treatment for post-stroke occupational therapy clients. Many people experience a cardiovascular accident, commonly called a stroke, each year. Restorative yoga can offer benefits including improved range of motion, reduced pain, reduced stress and anxiety, enhanced neuroplasticity, and more. What is yoga? Yoga is a mind-body practice consisting of 3 key factors, which are breathwork, also known as pranayama, meditation, and body postures, also known as asanas. While there are many types of yoga, this series will focus on restorative yoga. This style of yoga focuses on deep relaxation through gentle postures and stillness, using props to promote calming the nervous system. Before beginning the practice, be sure to obtain consent from your client. Talk to your client. Ask if they have ever heard of yoga or even practiced. See what base knowledge they have and work from there to introduce using restorative yoga as an intervention option. Educate your client that this type of yoga focuses on gentle movement and stillness, not challenging poses or deep flexibility. Remember, consent is ongoing, and it is important the client understands this. In this video, there are different areas of consent, including physical touch, sensory experiences, emotional regulation, spiritual well-being, and more. It is important the clients feel safe and know that the practice can stop at any time. The conversation of consent helps to keep both the client and the practitioner safe. This video series is appropriate for clients at home, in the clinic, and in hospital settings. I will include tips to help tailor the practice for different settings and different types of clients. Using the Ayurvedic model of human occupation, this will guide practitioners in using yoga as the intervention in occupational therapy. Under this model, the main intervention is yoga. For environmental suggestions, this will largely depend on your professional setting and what is available to you to use. The yoga practice will take place on a safe and secure surface. That can look like a yoga mat on the floor, a therapy mat, a bed, a couch, whatever works for you as the practitioner and for the client. Of course, make sure the setting is clean and prepared for the client. Please be sure to avoid harsh overhead lighting if the client is in a supine position. In fact, the lights can be dimmed or even turned off if there is enough natural lighting. If the setting allows, a candlelight restorative yoga practice can be quite pleasant. For sensory considerations, essential oils can be a nice way to include a sensory experience in this practice. This can look like using an essential oil on a cool cloth over the forehead, or something like an eye pillow with lavender scented beads. Not all clients will want to add scents to the practice, so be sure to discuss beforehand to ensure the practice goes smoothly. Light music can be played as soft background music as well. Check out some playlists before the practice, and I suggest using keywords such as meditation, slow yoga, restorative yoga, or mindful yoga. Let's go through different types of props that will be included in this video series. Now keep in mind, with restorative yoga, the focus is on deep relaxation. The purpose of the props is to support the body in passive poses to achieve muscle release. Each of the props we'll discuss can be instrumental for comfort and support for the client to restore and relax in this practice. This is a bolster. These are large, sturdy pillows. If you don't have access to bolsters, a couple of regular pillows will likely work. These can be used in several ways, including back and upper body support when reclined. They can be used for low back support by supporting the legs in a supine position, and more. This is a meditation cushion. It can be used on a therapy mat, or on the floor, or a chair. Any comfortable seat can be used in place of this cushion. Meditation cushions can provide an intentional seat that provides proper alignment and reduces strain on joints. Also, having a meditation cushion can help establish the ritual or enhance the client's mindset and be ready for the practice. Weighted packs or sandbags can be used to provide deep pressure sensation to decrease feelings of stress or anxiety. They can also increase grounding in the practice and help the body experience passivity during the practice. Blocks can be used to provide support or as an extension of the body. There are multiple settings. They can be used at multiple heights depending on the need of the practice. There are different types of blocks, including foam or cork. Foam blocks are more cushioned than cork. If the client has pain or other sensory issues with cork blocks, a soft blanket or towel can be used to cushion the cork block. The important part to remember is the block needs to be flat on the surface for safety purposes, as the sides can tip and compromise client safety. So make sure the block is flat on the surface and not wobbling on an edge. Yoga straps can be used for stability, strengthening, or stretching. A gait belt can be used in place of a strap for this restorative practice. Yoga straps can help increase range of motion, mobility, and allow for deeper stretching. Yoga balls. You can use lacrosse balls or other therapy balls as well. These are used to help loosen fascia and relieve tension throughout the body. Yoga balls can also help increase body awareness through sensation where they are placed along the body. Blankets. They can be smaller or thinner, and they may need to be folded several times more for the desired support. Towels can also be used. Since restorative yoga holds postures longer than other types of yoga, the client might become cold and may need a blanket. It is important for clients to feel comfortable during this practice to receive optimal results. For practitioner preparation, it is important to remember that as a practitioner, you are facilitating the restorative yoga practice, not taking the class alongside the client. Sometimes it can be helpful for the practitioner to demonstrate a pose for visual clarity and then to help guide the client into that pose. The practitioner can sit nearby to the client and facilitate the rest of the practice. I strongly recommend attending a restorative yoga class prior to trying this in your clinical practice. As practitioners, it is important to practice what we preach. We can better prepare for treatments if we've had some experience with the intervention personally. I strongly recommend at least attending an in-person restorative session so that you can get the full experience before trying with a client. During your personal class, think about how your body feels during each pose. Consider how the poses may or may not work for your client. Remember, trying a new intervention can be challenging for the practitioner and for the client. Consider practicing with your coworkers or a friend first. This can help you determine if there are gaps in your clinical knowledge for using restorative yoga, gaps in your language for guiding a client through the practice, or any confidence level concerns before you try and practice. A confident and prepared practitioner is the most effective in leading this practice. In the upcoming videos in this series, I will be leading a restorative practice with a mock client. I look forward to seeing you there. Thank you for watching Restorative Interventions.